small enough that you could drown it in a bathtub. So, and you ask, why would she want to channel him? And then he had to think about, how do you do it? How do you get government small enough to drown it in a bathtub? And his epiphany after that was, starve the beast. And the way you starve the government is to eliminate taxes. You demonize taxes. So then after that, they created this right-wing book of special sayings, and one of them is tax burden. Never say tax without saying burden. Taxes are always a burden. And demonized taxes and demonized government very successfully. And that is why the Harper government, despite saying we're in a fiscal crisis, we can't afford core public programs like public health care, is still cutting taxes. And, you know, they use these justifications like, well, it's going to create jobs and economic growth. And if you look at the evidence, of course, it's not borne out in the evidence at all. And it's actually not rocket science to figure out why. Because if the government taxes a corporation or a wealthy individual and puts that money into program spending like healthcare and education, they're hiring teachers, nurses, doctors, health professionals, care aides, physiotherapists, chiros, they used to. And those people live and work in the local communities where they spend most, if not all, of their salary on local services, which employ other people locally who spend all of their salary on local services. If you took that same money and you gave it to a corporation or a wealthy individual, they are just as likely to take it to Hawaii and spend it on their condo. They are. They're right now because it's cold here. So it's not surprising that if you look at the data, the evidence doesn't bear out that tax cuts create jobs. Direct spending on healthcare and education, if you look at the government's own multipliers, give you better bang for your buck in terms of job creation and economic growth for any dollar spent. Healthcare and education, you get more jobs and more economic growth than if you give it away as a tax cut. So it's a no-brainer. It's a great investment, and it's a good way to stimulate our economy. And I was debating a guy from the Canadian Taxpayers Federation, Scott Hennig, and when I was debating him, every time he opened his mouth, all I had to say was, yeah, but Norway. Yeah, but Norway. Because Norway entered the recession later than almost every other OECD country. They had the shallowest dip, and they came out the soonest. And they had the highest consumer confidence in the OECD. And Norway has a bigger public sector. And it's not in spite of their big public sector, it's because of it. And they invest in programs like a continuum of care for seniors that's public and affordable, accessible. So there is a clear and concerted agenda to undermine public health care. And I thank you all for coming out tonight, because in December, when Flaherty announced that they were unilaterally in a take it or leave it dictate from the federal government, telling the provinces, take it or leave it, here's what you get, and that it was going to be eliminating core tenets of what we value in healthcare, that really represented the Harper government's intention to undermine this program. And that's what he did in that December announcement. It included a few really big changes in direction. One, of course, that it was dictated. It wasn't the federal government negotiating. It was the federal government giving an edict to the provinces. So that really shows a different relationship of us as a nation. It's tying our spending now for healthcare to economic growth after 2016, instead of to drivers of healthcare costs, like new technologies, if they come on, that citizens want and are willing to pay for with their tax dollars. Or aging, which is, though not going to cripple this system, is going to cost some money. Or population growth or inflation. No, he's tying it randomly and unilaterally to economic growth. And those of us from Alberta, I know BC has some boom-bust scenarios, but not like us in Alberta. We ride that roller coaster really rough, all the way up and all the way down. We know what economic growth looks like. It's booms and busts. And if we tie our healthcare spending to economic growth, it's going to look awful. It's not a practical way to plan long-term spending for critical social programs. The other thing that announcement was included is a move away from equalization. And that's where the federal government used the health transfers to even out the healthcare revenues across the provinces so that all provinces had an equal amount of health so that they could offer equal levels of service. And this is one of the core values that we see this federal government abandoning: universality, equity, and taking care of each other. Wealthy provinces like Alberta, and I have to admit, I'm ashamed. I'm often ashamed of my province, of my the Tory government, especially around energy policy, but now on healthcare policy. They're willing to back the federal government's winner-takes-all cash grab for Alberta, because we don't have enough with the oil and gas wealth that we refuse to share well across the country. We're going to cash grab from places like Nova Scotia and Ontario, our new have-not province. So the change that's showing up in this new formulation by the federal government is that we're not going to have the wealthier provinces share with the less well-off. We're not going to take care of each other. Harper is trying to rewrite this nation in the image of the United States, and I mean, really, look where that's got them. So it's a meaner-spirited country that he wants us to have, where we don't take care of the less well-off, blame the poor, and the wealthy don't have acknowledgement of their privilege but feel it's their right. And wealthier provinces feel it's their right to cash grab from the less wealthy. It's redrawing the map of what we value as a nation. And so that's why I'm very glad you've all come out tonight to participate in this forum, because this is about more than healthcare. This is about who we are as Canadians, and Sean mentioned that. It's about a nation where we care about taking care of each other, sharing. I mean, we've learned that in every part of this country. We've had to take care of each other to keep this country going and keep our communities going forward. And healthcare is just one piece of how we share and take care of each other. And it's how we pool our resources to buy programs together, instead of being out there one-off in the market where we get taken advantage of. Anybody here knows you try and negotiate one-off with your employer as compared to negotiating as a group, you're not going to do as well. And that's why people shop at Costco, because bulk purchasing is cheaper. In fact, I'll end with a great quote for you from Calgary, you know, the famous surgery center in Calgary that went bankrupt. They were actually charging more per surgery than the public system was paying. They were charging, so it was very expensive to do the surgeries in that center. It was privatization isn't some magic bullet that'll save us money. But anyway, so when they went bankrupt, before that, they had put a submission in to the Alberta Health Act debates that said, the public system benefits from economies of scale and bulk purchase that's unfair. And they did. And they said in the new Health Act, Alberta had to make sure there was a, and I quote them, this is from the Calgary Chamber of Commerce, on behalf of private surgeries, a quote, leveling of the playing field. For those poor for-profit surgeries that didn't benefit from the economies of scale and bulk purchase deals that the public sector got. The public sector, Medicare and public delivery is a bargain. It's cheaper, delivers better quality, and private for-profit is not the answer, it's the problem. Thank you.
And now I'd like to introduce our next and final speaker, Maude Barlow. Maude is the national chairperson of the Council of Canadians and chairs the board of Food and Water Watch, a Washington-based organization. She is founding member of the San Francisco-based International Forum on Globalization and a counselor with the Hamburg-based World Future Council. She's getting around all sorts of places. Maude is the recipient of 11 honorary doctorates as well as many awards, including the 2005 Right Livelihood Award, which is known as the Alternative Nobel. In 2008 and 2009, she served as senior advisor on water to the 63rd President of the United Nations General Assembly and was a leader in the campaign to have water recognized as a human right by the UN. She is also the author of dozens of reports as well as 16 books, including the international bestseller Blue Covenant, The Global Water Crisis, and the Coming Battle for the Right to Water. In other words, I didn't really need to introduce her. Maude Barlow.
Wow. Thank you very, very much for a gorgeous introduction. Sean, thank you, Rachel, and the coalition here, all of you guys who've done such a wonderful job here tonight. Diana and Mike, an honor to be on this podium with you. I am thrilled to see this big crowd here today because we're told that Canadians aren't interested in such things. So I keep saying to my mainstream media, I won't call them friends, perhaps, just people I'm trying to bug into coming to things like this. You should come out to an evening like this. You might be surprised at who's here, but anyway, I'm just delighted to be here. So as you know, the health ministers and the premiers, of course, are gathered here for the most important negotiation, I would argue, on healthcare perhaps since the 1960s. And that's because there are a set of threats to our healthcare that haven't existed in decades, and it's really an ideological struggle, as my colleagues have talked about tonight. And it's part of an international assault on the very notion of government, from deregulation to privatization, and of course, free trade. And Diane and I just laughed. I showed her, I had a Grover Norquist quote about the bathtub coming up next. But it is a great image that he said the ideal size for government was small enough to put in a bathtub so you could pull the plug when it was time. After 30 years of liberal market fundamentalism, we are seeing a set of deliberate policy choices and the transfer of wealth and power to corporations and a superclass. And I would say that this is an extremely organized undertaking. The 3 richest men in the world have more money than the poorest 48 countries combined. While 1.5 billion people in the world, that's half the global workforce, are unemployed or live working in precarious working conditions, governments are shutting down social programs, environmental protections, and of course public services such as health care. We know the story in the United States. There are now 52 million people officially without health care insurance. Naomi Klein calls this the great sacking and says that they have the nerve to think that it's such a good thing that they do it with all the lights on, because this is just the sense of entitlement of this class. And I like to think of our leaders, our political and academic and corporate leaders, as forming a kind of global royalty in which they kind of have more in common with each other than they do with the people of their countries. And I think our world is more broken by class now than by geography than ever before. I love my favorite Occupy sign, I think caught this the best. It said, "If you won't let me dream, I won't let you sleep." And you wait till the spring. Occupy is coming back, and it's coming back with a vengeance. Now, Canada has undergone the same process, and the only reason our finances aren't as big, and I just want to take a minute to boast a little bit about the fact that back in the late 1990s, the government, liberal government, tried to deregulate or intended to deregulate the banking system, and I remember our organization led a big fight against this, and now not only does Jean Chrétien take total credit for saving the economy, but even Stephen Harper claims it, and I think, give it a rest. It was a citizens movement and a fight with us and the labor movement and other groups in Canada that stopped them from doing this, so there. Nevertheless, as you'll remember, some of you, Brian Mulroney, when he came to power, saying, "Give me 20 years and you won't recognize this country." And in fact, he was right. And we have moved demographically from looking like a large egg with a large middle class to looking more like a pear, with fewer and fewer of us holding power and financial security at the top, and more of us falling out of the bottom. And of course, more and more of us one paycheck away from welfare. The top 5% now take home 40% of the income, while the bottom fifth are left with just 7% of the pie. That's in Canada, that is still relatively equal if we compare ourselves to the United States, but quickly changing shape. Now, I think we have to say it to each other and ourselves, and that is that Stephen Harper is the most right-wing prime minister we have ever had in this country, and in my opinion, he's dangerous. This is a man who is not only a neoliberal financially and economically, but a neoconservative socially and politically, and that's a very dangerous combination. Brian Mulroney was not neoconservative in the social sense, in that sense. So we have a very dangerous combination. And he is absolutely determined and clear about what his agenda is. He's of course, going to be overseeing this whole process with the renegotiation of the healthcare accord. And so we need to stop and remember who he is and what he's about. He is absolutely ruthlessly cutting any opposition. Most recently, he cut funds to the Canadian Environmental Network, but you name the group that may not even have criticized or critiqued, but may have some ability to do so in the future. Their funding is gone, and I am so grateful that my organization, the Council of Canadians, never took 1 cent from government. Not that they'd ever have given it to us, but you know, in fact, we can't even get charitable tax status, and what seemed like such a struggle for so many years now is a blessing because we had to learn to do without it. But we're watching one group after another go down because they simply have had the funding totally cut. He's closed committee hearings, speak to NDP, members of parliament, and they will tell you that they're being told in committee meetings that that these are now closed and they're not allowed to say if they have how they voted on something or what was said. Slashing Environment Canada. We're not even allowed to know the names of the scientists that are being so-called downsized. And of course, you know the appalling position that our country took on Kyoto. You know, leading countries like China and France to actually come out and publicly, you know, scold Canada for this terrible position. We've killed the wheat board. Absolutely, this is one of the most important traditions, the most important institutions in our country that stop the major American grain companies from coming in and taking over that sector, that brought money and revenue back into communities. It brought a decent return to the farm gate. This was a marketing board that was both as exactly the same description that my colleagues have said about healthcare, good economically, but good in terms of social justice. So of course it has to go. Forcing municipalities to turn to private water companies if they need federal funding for new water infrastructure. But yay to the people of Abbotsford who had the courage to say no to $67 million of Harper's money. Stephen Harper is even promising bonuses to senior government bureaucrats depending on how many people they fire in this downsizing. He's actually giving bonuses based on the number of people that they let go. That is no way to make a decision about who should be let go in a downsizing. And now they're negotiating a new bad trade agreement called CETA, the Comprehensive Economic and Trade Agreement with Europe. And when you think about Europe, you may think, well, Europe has got better environmental standards, better labor standards. Put that image away. That's an old image of Europe. Europe is going through massive privatization, massive deregulation. They've signed a procurement agreement with one another in which they are allowing each other's corporations to cross their borders and be treated as domestic industry, and in turn are privatizing the public service to give them opportunity. It is a dangerous agreement to every public service, to every local rule, to local food programs to public health in every way. This government is just plowing ahead with it. And unfortunately, it seems all of the provinces, including ones that should be more friendly to us, are going along with it. And we know that we're going to see the cost of drugs rise to close to $3 billion a year in Canada if CETA is signed, because Canada is agreeing to adapt our patent regime to the European pharmaceutical regime. This is a government that says it doesn't have money for health care, and yet it's got money to spend $3 billion on drugs. Well, I guess it's us that's going to be spending it, so they don't care about that. Remember that Stephen Harper, excuse me, once led the National Citizens Coalition, which was founded to fight public health care. The founder, Colin Brown, was a life insurance salesman. He was a wealthy life insurance salesman, and he said that public health care in Canada would kill millions of Canadians. That was his quote. Stephen Harper is on record many times as saying he believes that health care should be turned over to the provinces in terms of financial responsibility. And of course, he's allowed the privatization of health care services in many provinces, and leading in many ways to the death by 1,000 cuts. So we need to be very conscious as we're entering this process, and as these premiers are meeting over downtown in that hotel, that this is the backdrop to what he and several provinces have in mind. They are basically using this occasion to set about the total renegotiation of health care in this country, and we're going to find ourselves moving steadily backwards. As Diana said, he knows that he can't do this through the front door, like he destroyed the wheat board. He just said, I don't care what you think, it doesn't matter if it's illegal, it doesn't matter if it violates the law, and we are joined with other groups to take that to court. But he said, I don't care, I'll just change the legislation if needed. And so what they've done is they basically pulled the rug out on this financing, which is going to cost the provinces about $31 billion in lost federal revenues over the duration of the accord. And the Parliamentary Budget Office says that with the cuts that they have announced, unless something changes, and the next election is a good chance to do that, that the federal share of healthcare funding, which is now 20%, will fall to 13% over the next 2 decades, and steadily below that in the future. Now, this is a brilliant strategy for a man determined to kill public health care in Canada, because he doesn't have to do the deed himself. He could just turn it over to the provinces and let them do the dirty work. If they're eager to do that, then they're going to enter into a private system immediately. Excuse me, others will take more time to do that. What we're going to end up with is a patchwork of services, many of them privatized, and of course the end of a national dream of health care. And the promise at the heart of Medicare, and that promise is that you can go to any